Tulikuwa na shida sana. Mama alikuwa anakufa sana. Alikuwa na utoto wake alikuwa ndani.
Zamani hapa wasichana wengi nakufa. Hata ile mimi najua kina mama mingi nakufa. Shauri anashinda kusaa. Ndio nafungwa. Hakuna mali ya kutoka na mtoto.
Zamani vile wametairishwa hiyo wembe amebitia mali mbaya hata ameshinda kusaa. Kwa maana shauri amekatwa mbaya sana. Mgonjwa hata anamagika.
Despite its status as one of the largest economies in East Africa, large sections of the Kenyan population live in poverty. Most of the predominantly Somali agro-pastoralist population in Mandera live below the national poverty line, and dependence on livestock for food and income leaves families extremely vulnerable to shocks. Given their nomadic way of life, where they move in search of water and pasture for their animals, they face poor access to health services, in particular maternal and child health services, information and rights. Maternal mortality in Mandera County is over twice as high as the national average, with poor access to safe motherhood services and child health interventions such as immunization. Poor maternal and child health is partly due to lack of culturally appropriate approaches to addressing pastoralist health needs, compounded by low numbers of health staff with poor training, ill-equipped health facilities, and a lack of awareness regarding the health issues among pastoralist women.
At home, they do not have safer area for delivery. Most of them you do get, they lie down and give birth in the soil.
A lot of mothers, due to ignorance or due to cultural barrier, still believe someone's mother was born in the village. They want to give birth to a child in the same place.
Facilities are far apart, and here we are dealing with a nomadic society. The kind of nomadic clinics that we have is not adequate. Like now in the entire Mandera East, North and Lafi, we only have one nomadic clinic.
It takes time before the TPAs try in all kind of herbal medicines and all kind of maneuvers. And the time they are referring these patients to the next service delivery point, the life of the mothers and the babies are also at risk. The community here is Muslim, so to speak, they are Somalis, and they prefer the female midwives, unlike the male midwives, which have the dominance in this part of the county.
Also, poor infrastructural development has caused really the high mortalities in Mandera.
In an effort to address these challenges, Health Poverty Action, in partnership with Emergency Pastoralist Assistance Group, EPAG, implemented 2 programs in Mandera County: Realizing Maternal and Child Health Rights, REACH, a cross-border project funded by the European Union, and Improving Maternal and Child Health Outcomes, Global Poverty Action Fund, GPAF, a DFID-funded project.
Our main objective here is to reduce maternal mortality rates and also the under 5s. We partner with EPAC, Emergency Pastoral Assistance Group. They are doing their activities and we support them. The other associates in this now are IGRA, and we engage them every month to mobilize the communities and provide advocacy and awareness on importance of immunizations through using theater shows, drama, songs and all this.
The project is targeting the pastoralists who have been sidelined and marginalized for quite a long time, affected by clan conflicts and poor health services.
EPAC and HPA, we have a very bonding partnership in terms of service delivery in maternity. They provide referrals in, and when mothers are even being returned, they give return transport. They are facilitated in training of newly recruited health workers in terms of EMOC trainings. This has helped in reducing the maternal mortality.
I am well versed now in emergency obstetric care management, where we went Nakuru for that training.
Since EPAC started offering those trainings, the number of referrals have reduced because some of the cases that we used to refer, now we can manage on the ground.
Both REACH and GPAD projects have conducted several activities at facility level, at community level and at county level, in an effort to meet their objectives in Mandera North, Mandera East and Lafi sub-counties.
We have refurbished 3 facilities. We have equipped them with obstetric equipments so that they have the capacity to provide basic and comprehensive emergency obstetric care.
Occasionally, we go with them around the facilities so that we identify their challenge and also offer on-site mentorship, especially to healthcare workers in the peripheral health facility. They have also supported us in terms of procurement and distribution of RH equipment.
They have supported us with an incubator. They have given us resuscitator. They have also given us delivery equipment and maternity equipment. They have also renovated our MCH.
They've been very instrumental in saving life. If you look at our chart on deliveries that we're having, a year ago we were getting something like less than 50. Today, some month we clock over 200.
The projects conduct constructive advocacy to help policymakers and influencers understand the value and costs of providing maternal and child health services and information in a way that can be accessed by mobile pastoralists.
We support the MOH to carry out monthly outreach integrated mobile clinics. This is to reach all children in a nomadic setup.
Offering all kinds of services: antenatal care, postnatal care, treatment of minor illnesses, immunization of antigens, all antigens.
HP na EPAC wanatoa msaidizi mingi kwa kufanya chanjo ya watoto na mama mzito.
Anaenda kwa bula mama ambaye ako na mimba, mama ambaye maskini, watoto ambaye bado fika maka kadhaa ambaye ni sasa karibu.
There was also a need to strengthen referral capacity to ensure better maternal, newborn and child health outcomes. The project support emergency referrals using project-procured ambulances to reach Mandera County Referral Hospital for further management. Donkey carts are used at the community level to refer patients to the nearest facility. This was an innovative way through the health insurance scheme money.
markaan saacado joogo foosh aan xanuun said iyada si haya inta laga qaaday Mandera leegay ambalaasta lagu qaaday Mandera markii leegay toddoba bar ka bacdi hadana waa la soo celi ambalaasta lagu soo qaaday xaafadda la keenay
Tukipata na shida huko msituni sasa na mama ameshinda kujifungua kwa hiyo muda HP na EPAC tunaenda kwa mama kwa hospitali, madaktari wanapiga kwa hapo kwa HP ndio wanatuletea ambulance kwa haraka.
Given the current low level of family planning awareness, acceptance and contraceptive use, there was a need to develop a strategy that extends family planning information and services to communities beyond the few static health facilities. Communities and local leaders selected community-based reproductive health agents, CBRHAs, based on their willingness to provide the voluntary service as well as community trust of the candidates. The CBRHAs were trained, then assigned to the respective communities and given family planning commodities.
We trained CBRHAs who are able to support the mothers through the process of pregnancy to delivery by linking them to the facilities and also doing counter referrals.
Their work is to have clustered households around 50 according to the target facility and refer these mothers. If a mother is due for ANC services, that mother follows up so that she refers to the nearest facility for comprehensive care. She refers all deliveries. She traces immunization defaulters. They carry out health education, household health education on danger signs, on hygiene promotion, exclusive breastfeeding.
hay'adda ibaga la hay soo bartay maagaasi istaga loo geeyay ilmaha loo nuujiyo maxaamilaha iyo dhalmadaba istaga la xiriira nuugdiin si fiican loo fiiri
aniga maamada haday foolato 6 saac oo habeenimo ama 9 saac ama 10 saac waa la iga soo kicina anoo kareetadaydu wata ula imaada gaar ma qabo marka kareetadan ku qaadana istaalkan geeyna maamada tii ilaahay si san iigu dhalayna si sanay bay iigu dhashay tii kaleento oo la kari waayo oo xanuunkeeda saaid noqdana ambalaasa ii taagan ambalaasan u cawana ambalaasa ii maadi ruuxi waaba la qaaday isbitaal Mandera la geey si sanay ku soo badbaadayeen oo ku soo kala baxayeen ayagoo iska fiican oo hadana caafimaadkooda wato iyo hadana cid liigu keena
ku dhalisanahay marmar aal cunun istaal waa ku dhalay laakiin guriga ku dhali jiray badi laakiin inta ii imaaday wax weyn ay kordhisay isbitaalka la xiriir daawooyinka hadda bishii 9 hadda waan tagay
maamada maam fiican waa anta markii xaamilada ay kullu ay la socota dhalmada taanahay markii faash lee qabtay iyada bay qaaday istalagis ambulance oo qaadana fiyo ay maad ani cunugayga kala soconayma.
The project also supports community groups to establish early maturing vegetable gardens to promote child nutrition and fight anemia in women of childbearing age.
We started nutrition along the River Dawa under the community, what we call multi-story kitchen gardens. And we are targeting majorly spinach. And you know, spinach increases the hemoglobin levels within a pregnant woman.
The same CBRHs are the ones who are tasked to link the vulnerable members of the community, like the ANC mothers who are very weak, who are malnourished, children under 5 who are malnourished, to these fast-growing nutrition gardens. We have community conversation facilitators. These help in changing the community health-seeking behaviors. They facilitate community dialogues on social determinants of health, such as abandoning female genital mutilation, harmful traditional practices such as uvulectomy, the removal of the uvules, removal of milk teething.
Health is a fundamental human right, and the provision of comprehensive primary health care is essential to its realization. The REACH and GPOD projects have sustainably contributed to improve maternal and child health in Mandera County in Kenya by reflecting the specific needs and demands of marginalized pastoralists in policy and practice.
To ensure that the mother and child are safe in Mandera, we think of having what we call community units. We focus much on the community because we have to change the community to improve health-seeking behaviors within the community. That's the focus most on behavior change, while also strengthening referrals and strengthening the facilities to handle all emergencies.
Health Poverty Action continues to live up to its mission, supporting the poorest and most vulnerable people in an effort to achieve better health and well-being.